So today we are starting common diseases in practice of medicine along with electro-homeopathy treatment because these common types of diseases will come to your clinic and you have to treat in electro-homeopathy. That is our goal. Okay. So treat the patient with electro-homeopathy. If in emergency case is that, so you have to refer to higher center or refer doctor along with his advice or family concern. Okay, you can also try with electro-homeopathy medicines as a supportive medicines. Okay, so but fever, fever and hypothermia, rash, these are the common diseases or common symptoms that everyone will experience more than 2 times in a year, or else if his immune system is weak, he will experience every 2 to 3 months fever or hyperthermia. Okay, change of season will occurs, so he will have the fever. Okay, so what is fever? And let's see the definitions. Okay, and how to approach the fever and what type of treatment will be given in uh, modern medicine. Okay, but we have to know that, but we are not treating with that remedies. We are treating with electrohomeopathy only. This is the thing we have to understood, and this is the only responsibility. Okay, and we have the hyperthermia also. Okay, so let's see that and electrohomeopathy treatment at last we will talk. Okay, so here there are the different types of here they are giving different types, but I will explain in my own way that we have the in the body we have one gland that is known as hypothalamus. It is present at the uh, in the brain, mostly between the parietal and occipital lobe. Okay, their function, there's a number of functions in that. One main function is to regulate the temperature, to regulate the temperature. This is the basic thing, because if you maintain constant temperature in your body, so what will happen? The pathogen, the invaders, whatever present outside the body, they are not capable to enter into our body because of the temperature. Okay. So if they enter into our body, hypothalamus will get intimation from that area with the sensory output to the hypothalamus. Then what they do, they will increase the temperature to affect that area, to damage that pathogen which is coming from outside the body. Okay, this is one example. There are the number of things that will cause the temperature arising, the to arise the temperature, okay, by the hypothalamus. So main thing is to maintain the regulation of temperature, because when the energy is producing in our body, so the energy will utilize for the functioning of the organs, first thing, and the protection of the organs and mechanism of the organ. Okay, so these are the three main things. Why should we need the energy? Okay, energy is coming from the carbohydrates, energy is coming from the oxygen. So the combination of carbohydrates and oxygen leads to energy. Already you studied in physiology. So basically hypothalamus will regulate the temperature. Okay. Here what happened, that temperature arises. So we have normal temperature. If we go, we have two types of meters to check the uh, temperature. One is Celsius and another one is Fahrenheit. So mostly we check in Fahrenheit only. So in the Fahrenheit, what is the normal body temperature? Here 98.22 plus or minus 0.7 Fahrenheit. So if a person has between 98 or 97.5 to 98.9. So this is the normal temperature levels. So this is the normal temperature level. This is in Fahrenheit. If you want to check in centigrade, Celsius, okay, 36.8, 36 point, 36.42, okay, 37. So this is the normal in Celsius. This is the normal level, absolutely normal. If we go below the 36 or 97.5, we are going to the hypothermia. It means the body's temperature is decreasing. So it is a sign of death. Okay. If the temperature is increasing, it means the hypothalamus is doing or making large amount of energy. Okay. So how the energy is maintaining? Okay. Here hypothalamus is producing the energy. We are gaining the energy, but we have to lose the energy also. Then only the balance will happen. If the energy is only production is only happening, we are not utilizing the energy, so it will store and it will damage the body. So what is the how the body utilizes the energy? With means of two things. Okay, means this energy, hypothalamic energy. Okay, temperature energy. Okay, by means of two things. One is by doing respiration. So if you observe your respiration, that when you are inhaling or exhaling, when you are exhaling, you are releasing some amount of temperature in from your body. If you put your hand while expiration, you will feel the small amount of heat in the expiration. First thing. And second thing is by means of sweating. Sweating. Because of the arteries, veins supply to the external or skin level, we have sweat glands. So if the sweat glands receive large amount of blood circulation, means if the body is the you have heat, then the circulation is also increased. When the circulation increases, the sweat gland receive the large amount of circulation, blood circulation. So what they will function and they release the temperature, the heat from the arteries, veins with means of sweat. Okay. This is the two ways how we lost heat from the body. Okay. Here another use have we have three types of fever. Okay, means three. You can differentiate mild fever or mild fever, moderate fever, or we can call another name of the fever is best name is pyrexia. What we call pyrexia. What is the name? Pyrexia. Pyrexia. The pyrexia. Mild pyrexia, moderate pyrexia, and severe pyrexia. So if it is between 100 to 102 or 101.5, it is mild. From 100.5 to the 102 to the 104 or 105, it is moderate. 100 above the 104 or 105, it is hyperpyrexia or severe pyrexia. Okay. So these are the types of fever. So whenever a patient comes to your clinic, so first check the temperature of the body. This is the basic thing you have to check. And you have to check the pulse rate because in the fever the pulse is high. You have to check the respiratory rate. Respiratory rate also high because to release the heat from the body, our respiratory muscles they will react. So all the intercostal muscles, okay, all the intercostal muscles, okay, they will work. Okay. So you have to check, and you have to check the BP, blood pressure also. Okay, so this is the basic things you have to need to understand. So you have to write down the if this mild pyrexia, if it is severe or it is moderate. Now, these terms explain how professional are you. Okay, so you have to become a professional doctor of electromyography. Next is, so how to approach. He came into your clinic. This is all the can do like practical. Okay, so if the patient come to your clinic, you check the all the vitals and how to approach the fever. So you have to take the history of the patient. What type of history, onset, when did the fever started, and any symptoms to medications you have to ask, any trauma, everything you have to ask. And you have to do physical examination. This is very, very important. I already told you that you are taking the temperature, pulse, okay. If you are to, these are the noted thing. Okay, if person have typhoid fever, brucellosis, leptospirosis, fasciitis, these are the types of infectious fevers we'll discuss in infectology. Okay, infection diseases. Close attention to be paid to any rash. So you have to ask the rashes. This is the one of the thing, because it will indicate some other diseases also. Okay, these are the things maybe happen. Okay, and you have to check there is any ulcer, any infective things like lesion. Mostly, if the fever is not subsided, there is a chance of lesion in the brain, because in the hypothalamus, in and around, if any lesions is there, lesion means any small type of tumor, basic type of initial type of tumor. That's the simple definition you can think that. Okay, so if there is any lesion in the brain, so obviously the hypothalamus will function abnormally. Okay, and and these are the things you have to ask the patient. So then, if it is not subsided by the treatment initially given by you, or the patient coming from, they have passed 15 to 7 to 15 days, the patient took allopathy treatment or modern medicine treatment, other types of treatment, even though uh, the symptoms cannot be subsided, or the patient did not get relief from the disease. So you have to go with blood tests, because it is very important. Because very important, why the fever is occurring. Okay, so first you will do the diagnosis with electrohomeopathy initially. Okay, and you will advise 3 days medications. Okay, if the patient is okay with that, okay, or not okay with that, you have to go with the laboratory tests. So we have the tests like CBP or CBC, complete blood count, or ESR and CRP. This will give the the information about any infective cause. Okay, so this is the how to approach the fever whenever a patient comes to a clinic. Okay, what type of treatment will be given in the allopathy? That basically they have antipyretics, like mostly this is a common medicine used in the allopathy, that is paracetamol. Okay, according to the weight, they will prescribe the medicine. Okay, or secondary, that they will do the laboratory tests. So according to that, from where the infection is coming, from where the cause they will understood. So they will add some sort of antibiotics according to the condition. Okay, and the nowadays most common blood examination, that allopathy. practitioners are doing that. Blood culture, from that what type of bacteria is present in our body or what type of pathogen is present in our body, they will see, and they will prescribe what type of antibiotic will work. Okay. And simple treatment. First, if they have hyperthermia above 103, severe or moderate fever, so you have to do cold sponging. You have to take the sponge or duster. You can sponge, you can know that. Okay, now we will rub the board in our school days. Okay, so that sponge you have to put into your cold water and you have to rub all the forehead, backside of the neck, and chest region, and spine region, and palms, sole. Okay, uh, all this will be you have to do, or else here another thing you get cooling blankets. Okay, cooling blankets you have to pour one bucket of water, and you have to take the one blanket and you have to put the blanket, and you have to put on the patient. Okay, so it have to be done under observation. Okay, and other treatment they will give the according to the condition. If the patient heart rate is more, they will treat like that. If the BP is high or low, they will treat like that. Okay, if there any chances of lesion, they will do CT scan of the brain or they will do blood test. So all this will go day by day. They will go into deeper to deeper. Okay, so this is the thing we have to understood. But they, if everything is happen, we are not reaching to the reason, causative reason. So there are the chances of higher infections in the body, like tuberculosis. Okay, so vasculitis, rheumatic diseases, all the diseases are given here. Okay, osteomyelitis. So you have to need further evaluation. So okay, if the fever or infection is not subsiding. Okay, so this is the thing we have to know. Okay, here the chart is given, very very important chart. How they approach first, if the patient is approaching to you, history and physical examination, and because of the unknown reason of the infection or fever, you are stopping the antibiotic treatment and glucocorticoids. They it is for uh, allopathic doctors, not for us. So we have the chances of all these things. Okay, we have to go through this ESR, hemoglobin, you have to know leukocyte count, electrolytes, creatinine, protein, electrophoresis, alkaline phosphate, creatinine, X-ray also needed, abdominal ultrasonography also needed, and tuberculosis skin test also needed, urine culture, blood culture. Okay, according to that, we have to treat. Okay, so this is the chart. You can go through that. So basically, to treat the fever, we have to know that. Okay, and secondly, that we have to understand the reason also, and we have to go through that way of treatment. And if we are not treating the, if the infection is more serious, we need more further evaluation to reach that cause. Okay, so how to treat fever in electrohomeopathy? Already I told you that uh, we have to check the temperature. If it is mild, okay, three things: mild, moderate, okay, and severe. You have to ask the patient about the history, from how many days, from what is the onset, it is the morning, afternoon, and night. We will talk about different type of fevers also. We have typhoid fever, we have malaria fever, other different to differentiate different types of dengue fever. Okay, so to differentiate the symptoms. Okay, but in the simple terms, how to treat the fever. This is a simple thing we have to understand. First, if it is moderate to severe, we have to do cold sponging. It is very, very important. What we have to do? We have to do cold sponging or cooling blanket. You have to take the blanket and you have to put on the patient because of the severity of the temperature. To decrease the severity of the temperature, we have to do cold spawning. Next, we have to start the treatment of electrohomeopathy. If it is mild, okay, basically every fever will take time 1 to 3 days. Some take 3 to 5 days. Some take 5 to 7 days. Okay. So if the patient graph is starting with mild in the first 3 days, after 3 days in moderate, after 3 days severe, means in the body the severity of the infection is increasing. Okay. So at that time you have to read, you have to go to the reason. Okay. Why the fever is not decreased. Okay. If starting starting with severe, it is coming in severity days. Second, third day, it is moderate. Last 3 days, it is mild. It is okay, no issues. Okay. So mild fever is treated with, we have the three medications, three remedies in electrohomeopathy. One is F1 plus WE. F1 WE. You have to give in the D6. Okay. So basically, when you are giving the treatment, F1WE. So basically, you have to check the, I already told you, check the basic parameters like pulse, temperature, everything. Okay, if the all the things are in high, you have to give this remedy in diluted form. You have to first you have to give it teaspoon every 10 minutes, 15 minutes, according to the age. About 10 years, you can give 10 to 15 drops. Sometimes 20, 25 drops also. Below the 10 years, you have to check the age. 5 years, 5 drops. 6 years, 6 drops. 7 years, 7 drops. Likewise, you have to give the medications, remedies, okay, in diluted. If temperature is high, but all the other parameters is low, you have to give into the direct, not diluted. Okay, direct. This is the thing, very, very important because we doesn't get the result. If we are treating the patient, you have checked that in which, if is in hypofunction or hyperfunction. Hypofunctions means all the parameters are in low range. Hyperfunctions, all the parameters in higher range. Higher range needs diluted form of remedy. Lower range needs undiluted form of remedy. This is the basic thing you have to remember. F1WE and F2WE for outer side application on top of the head and occipital area. If it is moderate, we are not treating the cause, we are only treating the fever. In the moderate, you can add F1, A3, and YE. Again, if it is moderate, if more than 3 to 5 days, we'll go to the D5 or D6. Okay. And along with, you can have to apply externally F2WE. We are also selecting the same dilution for application also, D5 or D6. And the third remedy, S10 F1WE. Okay. This is the third remedy. We are adding three remedies here. Okay. And in the severe, in the severity, we need cold sponging. Along with cold sponging, we have to give the remedies. Severity, if the severe or hyper parexia, severe parexia, we need F1, S10, A3, and Y. In D6 only, you have to give a 5 to 10 minutes. Okay, first hour, 5 to 10 minutes gap, second hour, 10 minutes, third, third hour, 15 minutes. Likewise, you have to decrease the increase the timing. Okay, so it is D6 only. And the second one is F2 S10 WE. Again, we will apply on the forehead. And here another remedy, you can add F1 S10 A3 Y. Okay, this is the one remedy. And the another one is F1 A3 Ver1 plus Y. The third remedy. Okay, here we are taking Ver1 Y. Okay, and the if you know the reason, treat the reason also. Fourth remedy, like if you have chest infection nowadays, chest infection is more common, or else tonsillitis. Due to the tonsillitis infection, we have fever, or sometimes typhoid fever, sometimes malaria fever. We will talk about the reason. So fourth remedies, causative remedy, the reason remedy or positive remedy. Okay, likewise, we will treat the patient. Okay, so if we have all the laboratory reports, all those things, we will do the treatment according to the reason. What are the tests we have to advise to the patient? First is CBP. In that, we will see the TLC or WBC. If the TLC or WBC are high, means there is infection. And another is ESR also. ESR and CRP. Okay, these will indicates the inflammation in the body. Okay, and you have to check the fever profile, like we have Vidal test for typhoid, and MP malaria parasite, and we have the dengue profile. These are the most common seasonal fever. We have to go through that. Okay, if these are the negative, if the TLC WBC are high, means there is a active infection in the body. So to treat along with that. So you will get the symptoms. If the patient have chest infection, you will get the cough also. And uh, organic symptoms you will get. If the infection is in skin, in kidney region, the patient have burning micturition, pain in the abdominal area. If the patient have loose stools, you will get the organ related symptoms also. So you have to treat that organ or that cause along with these remedies. So we will definitely treat the patient. Okay, we will give the best results also if you treat the causative factor, whatever the reason behind the fever. So I hope you understood about the fever, about the reason behind, and how to treat mild, moderate, and severe, and what type of laboratory test you can advise to the patient, okay, to reach the deeper level of causative factor. Okay, so we will conclude here only. So if any doubts, kindly ask.